Je trouve que la
I think that medicine is the best job of all, because whether you do it well or badly, you're always paid the same way. You recognize it was Molière who said it. Today, the only obligation to have means is no longer sufficient, because to have an efficient medicine needs good results. System of remuneration is obsolete. For instance, a general practitioner, child of less than 2 years, 27 euros, 2 to 6 years, 25. A pediatrist, there are 900 different tariffs, and the patient doesn't understand anything, and the doctor has difficulties. Doctors in the cities are paid for each act. The one who's paid best is the one who provides the majority of acts. 71% of French executive people have a variable part in their salary, participation stock options. The English system uses the P4P, payment for performance, which has been existing since 2004. The British doctors are paid according to the result indicators. Who is the best paid? The annual average is in France 68,000 euros for 55 hours per week. In England, 120,000 euros for 48 hours per week. In France, we are coming to a system based on performance with the contract to improve individual practices, so that the insurance company pays a lump sum to the doctor and a variable part. And in the hospital, do we have to pay the professionals by interesting them in the activity and quality, individually or collectively? Which are the dangers of commercialization? Ideally, you have to bring doctors together in medical services which are multidisciplinary. In France, you have 61,000 GP, 55,000 specialists, 55,000 liberal nurses, and you only have 150 multidisciplinary houses. Does it mean that we have to boycott liberal medicine and that the gold nameplates of the doctors will disappear one day?
Voilà. Comme ce matin, vous voyez, on ne fait pas dans la dentelle.
You see, there are a number of problems. We try to answer how to pay our doctors. What are the criteria? In Pittsburgh, we try to limit the bonus of the traders. In Chamonix, the other summit, we try to integrate performance in the salary system of health professionals, whether they are good or bad, as Molière said. I'd like to ask you, Jean-Pierre Davan, president of the French Mutuality, because you have thought about it a lot. Well, I thought about it, and we have required a number of things, but we were also criticized. And I turn to you, because I don't like to speak to an audience by turning my back on them. I'm very interested in the way the round table is planned, how and on which criteria to pay for care. Before you know how, you have to ask for the criteria. I'm not sure if you remember, but there was a Chinese emperor who paid his doctors. He had several ones, of course. He was very rich. He paid them when he was not sick. When he was ill, he did not pay them any longer. Once he was healed, he considered himself to be healed and recovered, he started to pay them again. I don't think that our modern society can have such a despotic system. But nevertheless, it is true that we are in a country, in France, where there is no criterion for the payment of medical staff. neither in the cities nor in the outpatient treatment. And then we have to speak about drugs and pharmacies, because not only health services and treatments and care, which is being paid for, but also medicine and a number of other factors that are related to the medical services. I said there's no criterion at all for the payment, because I remember I had supported the reform movement of Alain Juppé at the time, who wished to introduce a new mode for the payment of medical doctors based on a number of criteria. For instance, the evaluation of a certain medical ethics, and he wanted to introduce in France, and this is why I remember this reform. He wanted to put into place in France what was done in the United States 50 years ago, the certification system for doctors. You certify the pilots who have to fly planes, and you're happy about it when you take the plane, which doesn't prevent you from having an accident, most of the time due to human factors. But in the medical area, when you leave the Faculty of Medicine in France with a degree, you can put your golden nameplate at your door, and during 30, 40 years work as a journalist or for an insurance company, and then change your plate and work as a doctor, which is surprising. I belong to a marginal species because I'm the only one, I seem to be the only one that's horrified by the situation. Now, remunerating based on quality criteria and not, as was said in the film, considering that everybody is good and practices good medicine everywhere, because this is the way they pay in France. If I can say, if the medicine we do in a small hospital is the same as in a big hospital in Paris, I don't think so, but the payment is the same. If you agree to establish criteria for quality, systems of the evaluation of practices and medical techniques, and if you agree to make a protocol of medical acts, because medicine is not an exact science, therefore you have to try to avoid risks. And then you can ask the question of how we pay for care services. And I think that healthcare professionals have to be well paid, and this is what I say everywhere. Everywhere I go, I say you have to be well paid, and I'm not sure that they are well paid in France. I wonder whether they are well paid. On the other hand, I'm convinced that the way of payment which we have established in liberal medicine for the hospital services, there are differences, of course, according to the situation, whether public service or private hospital or clinic, and participating in the public service. Therefore, there is a complete mixture. When a sick person enters into a hospital and goes to the practice of a doctor, he doesn't know, nor